All right, just waiting for Kate to join, but today we'll be talking about hypermobility and neck bracing.
Hello.
Hi, Kate, how's it going today?
I'm good. How are you, Sam?
I'm good. I'm so excited for this talk today and talk about some hypermobility and neck bracing because I know it's something that kind of comes up for both of us within clinical practice and personally. And it's something that I think is a controversial topic because there's not too much evidence on it as well. So I think it's something that needs to be talked about and like where it can be useful for helping people with hypermobility and in my population, which overlaps with migraine, and in what context we like to use this for.
Yeah, absolutely. And this is a conversation that I have a lot with my own personal physical therapist regarding recommendations, how there's a lot of fear mongering around bracing, and how there aren't really strict guidelines for those living with hypermobility and cervical instability. So I'm really excited to dive into this.
Yeah. So I know like right now there's no real formal guidelines published. So what we kind of go on then is clinical experience, expert reasoning, and there is like an expert reasoning paper that's out there on kind of what guidelines are. We kind of like talked about that and discussed that before because it is really important. Like what I think the title of the paper is Presentation and Physical Therapy Management of Upper Cervical Instability in Patients with Systemat Symptomatic general joint hypermobility and international expert consensus recommendation. So it's based on what experts have talked about and discussed and what they've seen clinically, but they haven't actually researched, is this something that is helpful or not in as far as like a clinical setting. I think it's definitely something for what I do with patients with migraine that talk a lot about and like subjective instability, where it's a little bit different than like a structural instability, but it can be really helpful to support the neck, especially when those muscles are getting too tired or just aren't able to support the head in their posture.
Yeah, absolutely. I mean, like you mentioned, there's no like randomized control trials to see
Mhm.
what's best, how to do it, what is the best hierarchy. So yeah, we definitely go off of clinical reasoning, anecdotal experience,
Mhm.
trial, a lot of different things. Uh, and that article that you mentioned has some really great recommendations as well, that you and I both use.
Yeah. So you mentioned before that this is something you've talked about with your PT. So what are some things as from the patient perspective come up for you and why you are using it?
Absolutely. So for me, I live with hypermobile Ehlers-Danlos syndrome, and I also have chronic migraine. So the I don't have diagnosed CCI, but I do have cervical instability. So like all CCI is cervical instability, but not all cervical instability is CCI, and that's
Mhm.
cervical instability is what I'm talking about, that upper cervical instability that we often see with people with EDS.
Mhm.
I don't have a formal diagnosis of that, but my physical therapist has diagnosed me with uh, hypermobility in my neck. Um, so for me, I never, I was always, going through PT school, I was always taught that to avoid bracing, like, oh, it can make you weaker, XYZ. So it wasn't something that I had really considered using until my PT brought it up because I was telling her things like, I can't sit at my desk for more than 30 minutes upright without neck support, or
Mhm.
I drive, because my neck hurts. All of these different things, I would get, you know, some kind of injury, like pull something in my neck, and then I'd have to be, head supported on the couch for a few days while that resolved, just like a strain, we get injured more
Mhm.
easily. So those types of things all kind of added up, and we started talking about what might it look like to start using a neck brace intermittently for those times when you feel like you need a little bit more support.
Mhm.
Uh, and I think that kind of changed my perspective from it, as it's not like it's not like I'm giving up or that it's like the end stage solution, but it's a tool that allows me to do more, really.
Yeah. And that's a similar way I look at it, using it with patients. It's they're talking about that subjective instability that they're having, and I look at that as like the muscles just can't support the weight of the head anymore, and they're too fatigued. Well, I'm not going to keep making them exercise and work out if they can't do it. I mean, that's just going to lead to more overuse and development of sensitization of that tissue. So let's offload it and give it support because that's actually what it's asking for. So a lot of people, I think, experience that like neck tightness, something like, oh, it's so tight, there's a big knot there. And then they're going to stretch it. It's like that's not actually what your muscle is asking for there. What that sensation that you're experiencing, that muscle is asking for you to support it and give it a break. So if you're just stretching it, you're actually probably going to make it worse or not helpful because your one stretching does make the muscle work. It resists that stretch, and it's not always relaxing. So you really do need to support the head in that instance. So you either lay down to get the weight of the head off the neck, or you find external support. So like you've talked about using the couch, people use headrests of their car, but I think collars or neck collars can be really helpful for intermittent use, like you just explained.
Absolutely. Yeah. I mean, it has certainly opened more doors for me. Uh, because there just isn't always upper back and neck support everywhere you go. So personally for me, this has helped me with things like traveling, driving, and like you mentioned, just times when my neck muscles are overworked and they just need a little bit of support. I have that like bowling ball head feeling,
Yeah.
I'm sure you hear that a lot.
Yeah, so like there's like the subjective report of like does somebody have cervical instability, and then I go by like, okay, what do you experience? That tightness in the neck, tightness that occurs with headache, feeling the need to self-manipulate, feeling the need for external head support. And I think some people don't even realize that they're doing that. I'll see a lot of people like with how my office setup is, the chairs against the wall, and the way they sit in it is they have their head against the wall. I'm like, that's a clear indicator that you need support because you're finding external places to offload stress. So when I start hearing that, that's like, okay, maybe this is a time to have a conversation about external neck support. And it's not something you might always need, but it's something that you can use to prevent neck pain, to help offset headache, or something early in programs where we're trying to exercise the neck, but that in itself then causes fatigue. Maybe after we do our neck exercises, an hour later, you put on the neck brace for a few minutes to help give it some rest. Similar to like if you were exercising, you went for a long run, you want to sit down for a little while afterwards. You want to get the legs a break. So it's like considering the same concepts there, just applying it to the neck and what the neck needs to move a little bit better and support you through the day.
Yeah, that's a fantastic point that you made. I think that oftentimes we think of neck muscles differently, but they are muscles and they should be looked at the same way, you know, uh, in regards to, strengthening and also
Mhm.
recovery.
Yeah.
Um, and bracing can certainly help with that rest and recovery piece. I know I'm someone who used to, always try to dig into those trigger points and do
Hmm.
stretching and whatnot. Stop stretching your hypermobile neck. Um, but
Yes.
I would find myself in these situations, where I'm literally, say, at a restaurant and I am like, hey, to my husband, Jake, like, hey, can I have your shoulder? My neck's.
Hmm. Yeah. So you're talking about something that the paper that we shared back and forth brings up, and that's empowering for increasing access to the community and support. Do you want to share what that was? Because I think you brought up a really good point. Because I didn't think about it as that way, but you as somebody that uses a neck brace, it was like that was really important for me to read that in this paper.
Yeah, it is. It's really empowering. I think at first I was somewhat hesitant to utilize bracing just out of, I don't want to say embarrassment. I guess maybe, because people always ask questions and things like that. But for me, since I've started using it during traveling, like I'm usually wearing an Aspen Vista brace while flying or if I have a long car ride. And I've even started using a soft collar if I'm driving more than like 20 minutes myself because it allows
Hmm.
me to kind of turn and look.
Yeah, we've
And
talked about that before. Yeah.
yeah, and that has really helped as well. I find myself saying yes to more things because previously it would always be that kind of thought process of, okay, how many hours do I need to be upright?
Hmm.
Uh, am I going to be able to lean up against a wall? Am I going to have support? XYZ. I had a really bad experience at one. We went to a restaurant that typically I know like has support, and we were sat in an area on bar stools,
Oh
and it
no.
was horrible. So those types of situations, I didn't have my neck brace on me uh, for that, unfortunately. But those types of situations, I mean, a lot of people don't really think about that when,
Hmm.
going out for social situations. Not everybody has to think about, like, can I remain upright for the needed duration of time to be able to participate in this activity. So, being able to put on a brace. I wore my neck brace a lot when I was traveling with my husband and my sister in England. We did a lot of train travel and, walking around in busy days. So I was certainly using a lot that support a lot. And I don't get me wrong, I'm also doing strengthening things
Yeah.
alongside this, which we'll,
Yeah.
talk about as well. But it definitely, I guess, to make your point specifically on that vacation in England, it certainly allowed me to do a lot more sightseeing
Hmm.
and walking around and being able to participate while reducing, and I won't say taking completely away, but reducing my neck pain,
Hmm.
uh, and reducing that strain on my head, which could have triggered a migraine,
Hmm.
uh, had I not been using it. So
Yeah.
yeah.
Yeah. So I think the summary of like when we should use it or who should be using it is, people that are hypermobile that have a lot of neck fatigue and find themselves doing a lot of external support, a lot of neck tightness would be indicators. And other like situations that would be beneficial to using it would be like prolonged working, especially if you're doing computer-based work, which is really common nowadays, especially with the increase in remote work. So it definitely improves your ability to participate in and maintain a career if you're able to use it for periodic um, during different periods of the workday to support you and get through the workday, and then through travel or social situations. So long flights, car rides, or social situations where you're going to be moving around and being more active, like at a wedding or a concert, or like another social event, like a big party or holiday party, where like I want to go, but I can't because I'm going to have neck pain or I'm going to get dizzy because I can't hold my head up anymore. It's like, well, no, now if we just go wear this brace for a little while, we can start participating in these social situations. So it really does improve accessibility for some patients, especially those that are more symptomatic with their hypermobility.
Absolutely. And that's huge. I mean, everybody wants to be able to participate in the things that they want to do. Nobody wants to be saying no in these
Hmm.
situations. And, you know, having that empowerment of being able to use a brace when I need it has allowed me to expand my options, I guess I will say.
Yes, I agree. So what are the benefits that you get out of it as far not just like accessibility, but as far as like the symptom relief that you experience?
Absolutely. It feels like a weight off my shoulders. That's funny. No, it I definitely experience a reduction in neck pain and also headache pain. I get a lot of, I have migraine disease, and it's, of course, we could talk about this for hours. It's very complex. You have,
Hmm.
migraine attacks and cervicogenic headaches, and, maybe they're all connected. But I know for me, if I am wearing a brace in a situation where previously I might not, like, say, a long flight, I will come out of that feeling much better than if I didn't wear it. So it saves me from flare-ups sometimes, I would say. It saves me from like neck pain and head pain flare-ups.
Yeah.
Um, and yeah, so that would be a benefit. Um, I mentioned ability, like in options to be able to go do other things.
Mhm.
Uh, trying to think of what else. I think that's a lot.
Yeah. I think those are the primary things. Like it can help reduce neck pain. It can help reduce headache if part of it is due to muscle tension or fatigue. And those are like the primary symptoms it can help with. For some people, if they start recognizing like, oh, 2 o'clock in the afternoon after I've been working for 4 hours, if I don't start getting support sooner, I'm going to have a headache after work, then they can put it on earlier and give a small rest break. So it can be used in a preventative manner if you've been pretty consistent with your trigger history. Know that like, if I do X for too long, I will get it. So then you know that you can offload earlier. So you can do it preventatively if you're recognizing that certain symptoms always come up and you have a pretty consistent like trigger history with that. So that would be the
Yeah,
other one.
that's a good point. I just jogged my memory. Sometimes if I'll wake up and say my neck pain, not baseline, but maybe a little bit above baseline, I
Hmm.
might like, okay, I'm gonna throw like my soft collar on while I walk the dogs this morning. Just like let's
Yeah.
just in case, preventatively. So I do kind of like check in and try to use it that way as well.
Yeah.
Yeah.
Now, one thing we haven't talked about is how long are you wearing it?
Yeah. So it honestly, it depends on the situation.
Yep.
So, for example, if I am going to be on a flight for 3 hours, I usually keep it on for the flight while I'm in there.
Hmm.
But typically speaking, um, probably no more than like an hour or so at a time, or even shorter intervals. Um, but I think that the most important point to get across is that it is so intermittent. Like I'll bring
Hmm.
it, some days I don't wear it at all. Some days I'll wear it more than not. And I think that with with dynamic disability, I think, you know, your symptoms changing throughout the day, it's like an it depends thing. But that is certainly one of the questions that comes up when you are talking about recommendations for neck bracing of, how long should I really be wearing this at a
Hmm.
time? How often? So maybe you can kind of step in and fill in some of that expert recommendation.
Yeah. So I usually start with people with 15-minute wears for it. And then usually maybe multiple sessions, especially if it's more like work related, like they work at a desk and they're starting to get headaches pretty often through the day. And we're also intermittent using it with and around exercise. So usually I might have a patient try it 2 to 3 times a day for about 15 to 20 minutes. Um, and then they're wearing it either like after a couple hours of work or after they exercise and then they're taking it off. They don't have to necessarily wear the neck brace, but they need to do something that gives the neck a break through the day. It needs like a little nap. All right, so what are
Hey,
we going to do to give it a little break? I like to start with 15 minutes, and then the exceptions would be going to social events and traveling, right? That's where it's like, you know what? Let's just prevent the pain that can come up with that. So like you have a 5 hour flight across country. Just wear it for the majority of the flight. You're not gonna atrophy your neck so much that you can't hold your head up anymore. It's just a one-off instance. It's not usual. Now, do I want you wearing it an hour or two every single day? No, I don't. But if it's for a travel or social situation and you want to get through it and socialize, well, I think the benefits of that outweigh the risks of wearing it for too long, right?
absolutely. And anecdotally, I've experienced benefits with that. Like I mentioned, recently I'm at that stage in my life where all my friends are getting married and such babies. So we're, flying for weddings and birthday parties and that type of thing. So for me, I look at it and I'm like, okay, if I can wear my neck brace on this like hour and a half to hour flight home, I am saving myself neck pain, head pain, and I will feel better for the event that I'm going to attend. which has worked out really well for me. So that's been really nice. And I like what you said about, the short intermittent use throughout the day, giving your neck a little neck nap. That's
Yep.
cute. I feel like I find myself doing that throughout the day. I have I'm looking over there because it's over there, but I have like one of those airplane kind of donut
Hmm.
soft things. So if I'm working on the couch, sometimes I'll kind of put that up there and totally so many options
Yeah.
of throughout the day.
Yeah. Well, why don't we actually show everyone a couple of options that they have for neck braces, and then we can talk a little bit about like the risk and pitfalls, which will actually be kind of the main part of our next talk next week.
Yes, absolutely. Should I start out with one, or do you want to start? I have
Let's start out with one, and then I'll do the next, and then you'll do the third. So we got three options to show people. Two are better or appropriate, and then I'll show a third that's kind of like a knockoff Amazon version.
yeah. Well, okay. So I'll show my soft collar. It is an Amazon version of a soft
That
collar.
the Amazon soft collars are kind of similar to the ones you get at a drugstore, and they're fine. I'm talking about like this, like, does this really work? I don't know. It's promoted a lot on Amazon. Is it worth it?
So this is the soft collar I have. Um, you know, Fairly like general. So it goes like this, and it has a Velcro strap behind the neck. And I have a very skinny neck, so I'm often like towards the end of the Velcro of these things. But this is how this one works, so I'll show it kind of from the side view here.
Hmm.
So it does give support, and this one I guess I don't use this one a ton. However, I have started using this one if I'm going to be driving for longer than like 25 minutes or so, I may use this as I can, kind of turn to look. And in my Aspen Vista collar, which I'll show you later, you can't do
No,
that.
yeah. So you definitely want to make sure if you're wearing a brace, it should be a soft brace while driving, and you need to be able to at least turn your head about 45 degrees because we know that's what is needed for safety and checking side view and checking blind spots for cars. So,
Yes.
and there is measurements for that. We know how much neck range motion you need to drive safely.
Yes. And so for this one, I like it because does it restrict all my neck movement? Absolutely not. But it provides just, a little bit of support if I kind of lean to the side, back,
Hmm.
front. It's just extra layer of support and I can kind of lean on it if I need to. But it does allow me to, move fully so you have that kind of full mobility and freedom. Take
Yep.
that off. One thing that I did want to mention with the soft collars like these is sometimes they can, and this was mentioned, and I believe the article that you mentioned, uh, that sometimes it can put you into more of a forward head posture. So
Hmm.
you want to make sure that you're avoiding that. And Sam actually gave me a really great cue because I'm always thinking about where my head position is. But the other day we were chatting and Sam said, you just keep your sternum up and everything else kind of,
Yep.
chest
We'll
up
fall back into place.
to place. And I've been using that for the last couple of days and it's very handy.
Yeah, I think the education in school was, the fewer the cues, the better. And people are
Yes.
always like shoulders back and head up, and it's like that's too many to remember. I just want one, and it was like if you just lift your sternum up, your shoulder blades tend to fall back into place. Your head comes more upright, and then you're kind of fall in that like slight head, that like upper cervical flexion position where it's more relaxed. And the only thing you're doing is holding your chest up. You don't have to think about the shoulder blades or the neck or the head position. They kind of just align themselves.
It's the best cue. I really, really love that one.
Oh, love to hear it. All right, so I'll do the next brace, and then we'll show them your J brace after. So this was an Amazon one. I bought it because it was on sale. I was like, well, let me try it and see what patients think. It's just a little clear device. Show the box real fast, like that. And I was like, does this really work? It seems kind of gimmicky, and there's pros and cons to it with how it is. So I'll put it on. It kind of goes on the neck, so you got to kind of like push it in. My neck's a little bit big on the sides, but this is where it kind of should be. Then it straps behind. So it feels, for me, it feels kind of claustrophobic. It's not my favorite feeling. I do like a soft collar a little bit better, but again, I think that puts you in a forward head posture where this one doesn't really. And then you kind of crank this up to where you kind of want to be supported. So here I could like watch, do some work, type at a computer. It does feel pretty supported. I don't like a little bit how much pressure it puts on my chin. Even if I push it back more, it's still putting some pressure on the TMJ joint. So if you have a jaw issue, it might be problematic for you. But you can see here, I'm not really in a forward head posture with this one compared to that soft collar. So it's kind of recommended. It's pretty cheap on Amazon. I think it was like $10 when I got it or something like that. The only other problem I had is if you go too high, you're like, oh, I can't get down. You have to like take it off and then cycle it back around to reset it. So you can't like up it and put it back down. You have to take it off to redo it. So it's kind of like a weird design that way. There's not like a spring release mechanism for it.
Yeah,
You have to just like go all the way around.
that's
But
so
it's an
fun.
okay device. It's not bad.
It's, you're just kind of like stuck back there. That's
Yeah,
funny.
it's like I don't like that.
uh, that's a great option though, certainly.
Yeah. Yeah, I was
Uh,
actually surprised that I was like, this isn't as bad as I thought it would be because I like trying stuff out. Patients get weird things, and it's like, do I want to recommend that? Do I not? So let me see and let me try this out for some patients before they go and spend a bunch of money on stuff.
Absolutely. There's so many options out there. It's absolutely crazy.
It is, yeah.
Um, so this is the big boy. So this is my Aspen Vista collar. This is
That's what's so good.
classic neck brace. I'll put it on and we can both kind of talk about it. But the
Yeah.
way is it has a lot of different Velcro attachments. I've adjusted, all of the padding to what works for me. Again, I have a very like tiny, thin neck, so it took a little bit of trial and error to get the pads where they want to be. But this is what it looks like when it's on. So in order to adjust it, I just turn this dial and that brings this part up and then you can turn
Okay.
it the other way and it brings it down to
Nice.
kind of get that like level of support. Again, it has more, it's contacting me all the way in the upper thoracic, so I'm not in that forward head posture. This
Hmm.
feels very comfortable, very secure. I'm not, you know, getting, unless I really force it, I'm not getting like extraneous movements here. Of course, it's not going to be as stable as, say, some kind of Halo device,
Yeah,
but
but you can't live with a Halo device, so I mean you can, but you shouldn't be taking that off if you need it.
no, you shouldn't. So this is about as good as it gets, I think, for, well, there's like the Miami J, which I
Yeah.
don't have, but
Yeah.
this is one of the better options. I did get this on Amazon,
Yeah,
actually.
so that one you can get on Amazon. I think the Miami J you might have to specialty order, but they're very similar. They're very similar. I think this one is a little bit cheaper, but if you're using it for instability purposes and hypermobility, I think you're not going to go wrong with getting this one versus the Miami J.
Yeah, I agree. I think this one is just, like I said, it's kind of the classic, uh,
Hmm. Yeah, it has
and
the chin support. It has the chest support. It provides total contact through like the base of the skull, so you're really supported there.
yes, it's fully like you said, there's a lot of contact and cushioning with the contact, so it's very comfortable. One thing, like you mentioned with the other one that you had on Amazon, is that sometimes this can irritate my TMJ.
Hmm.
I have a hypermobile jaw, which is so often with our like neck hypermobile patients. We can often see hypermobility in the TMJ or issues with the TMJ as well.
Hmm.
Uh, so for me, sometimes it can irritate it. I do have a splint that I wear on my bottom teeth for my TMJ, so that does help alleviate some of that pressure for me. So it's been a little bit of trial and error. But again, I'm not wearing this all the time for hours a day. There's some days that I'm not using this at all. Other days, it's like the end of the day, man, I just need to get a little bit more done and I need to be upright. or, a social event where I need to be upright longer than I know my neck can tolerate, or preventatively when traveling.
Hmm.
Um, but this is a really great tool in my toolbox.
Yeah. And that's exactly what it is, like you've said. It's a tool in the toolbox. It's to help manage certain symptoms, but it's not something that needs to be used at all times unless you have a very bad structural issue before you look for a surgical reason to intervene. And that's the one exception for 24 hours, 24-hour use for these devices is because you possibly need surgery and you've discussed that with a neurosurgeon. That's really the only time we would recommend that.
Absolutely, yes. And just exactly what you said. The only reason that you would be in it all day is if you were awaiting a surgical procedure. So
Yeah. I think that's everything for today. So I think we get ready for our next one, which we'll talk about some of the pitfalls, and we kind of already talked briefly about them, where like the TMJ issues can come up with them. So what do you do to help mitigate that? You talked about um, the oral appliance, and that's one thing. But we'll go into like more detail, like what TMJ issues typically come up, ways to work around it, and also like issues with neck strength, because that's one of the big criticisms for and I guess controversies for it is that it can cause muscle atrophy or muscle wasting. So the muscles can get weaker if you overuse certain things. So what we can do to mitigate that when we are using bracing and strategies to make that fit more comfortable and when to use it for you.
yeah, absolutely. I'm really looking forward to part two where we can kind of delve in a little bit more on those kind of risks and pitfalls and how to mitigate them. I am a big proponent of strength training, and I
Mhm.
can't wait to show off this
Yeah.
fun little device that we'll chat about next time.
Yep.
Uh, so, really looking forward to it, and thanks so much for having me on, Sam. It's been fun chatting about this.
Likewise, Kate. Yeah. And so the next live, the part two for this will be next Tuesday, same time as today at 12 o'clock.
Absolutely, and I'm gonna be, well, we'll be posting some posts to keep you in the loop on that. So hopefully you'll join us again next Tuesday. Thank you.
Yeah. All right. We'll see y'all later.
Bye.